Welcome to MinuteMED. In this video, we will discuss the heart sounds. Let's review the cardiac cycle and note when the heart sounds occur and where they come from. There are 4 possible heart sounds called S1, S2, S3 and S4. Before we get into the pathological sounds, we need to learn the basics of normal heart sounds. You have certainly heard the normal heart sounds illustrated like this. Physiologists refer to these sounds as S1, lub, and S2, dub. Both of these sounds are caused by the closing of the heart valves. Let's start, of course, with S1. The tricuspid and bicuspid valves, otherwise known as the atrioventricular valves, separate the atria and the ventricles. They open during diastole so that the relaxing ventricles fill with blood from the atria. When the ventricles contract during systole, the pressure in the ventricles increase. The increase in pressure pushes the atrioventricular valves to shut, resulting in the first heart sound as lub. On auscultation, S1 sound is best heard at the apex of the heart. Now, moving on to S2 or dub sound. When the ventricles contract during systole, they open the aortic and pulmonary valves, also called the semilunar valves. The contracting ventricles expel the blood through the semilunar valves by the pressure generated from contraction. After the ventricles contract, they relax during diastole. Ventricular pressure becomes lower compared with the pressure in the pulmonary trunk and the aorta. As a result, the blood flows backwards and forces the pulmonary and aortic valves closed, resulting in the second heart sound or dub, S2. Compared to the first heart sound, S2 is shorter, softer, and slightly higher in pitch. Actually, the aortic valves shut before the pulmonary valves. This is due to lower pressures in the pulmonary circulation, which allows blood to continue flowing into the pulmonary artery after systole ends in the left ventricle. In 70% of normal adults, this difference can be heard as the splitting of the second heart sound. In order to get a better understanding how the aortic pressure, ventricular pressure, and the atrial pressure changes during the cardiac cycle, check out this graph. That is all. Thank you for watching. Show us your support on Patreon, subscribe for similar content and click that bell icon. Don't forget to check out this playlist and follow us on Facebook, follow us on Instagram to stay tuned. MinuteMED, where medicine is made fun.